Hi, my name's Scott McGowan, CEO of McGowan Brabender. Today is a special event for more reasons than one. Several years ago, firms just like McGowan Brabender wanted to create a national organization to do three things really well. Number one, create an innovative antenna that spanned the United States. Number two, shape for scale and national leverage for cost, transparency, and data. And number three, a place where organizations that had a strong desire to remain privately held, creating jobs, opportunities for the communities we serve, could thrive and grow together. Today, it is a pleasure to introduce C2, a group of firms across the United States committed to serving the real payers of healthcare, employers and their employees. We welcome the Partners Group in Portland, Oregon, serving the Northwest Coast. Holmes Murphy, headquartered in Des Moines, Iowa, serving 11 states in 3 different time zones. M3, headquartered in Madison, Wisconsin, serving the upper Midwest. And Scott Insurance, headquarters in Richmond, Virginia, with offices throughout the Southeast. And rounding out, McGowan Brabender, representing the Midwest. We believe in innovation and creativity, and solutions are powered by local entrepreneurship. Although we're a national organization, we understand the value of regional expertise and real-time decision makers. The 2020 election could bring changes in the healthcare delivery system for everyone in the United States. Find out what the impact of the election could be for you and your employees. Together, our relationships brought this very subject to our attention, as well as our guests today. We are pleased to have Janet Trautwein with us today. Janet Trautwein is the Chief Executive Officer of NAHU, the President of NAHU, Education Foundation in Washington, D.C. NAHU represents employee benefits professionals involved in the design, implementation, and management of health plans all over the United States. A frequent speaker on healthcare policy issues, Janet's expertise in issues related to health insurance markets, the uninsured, risk and reinsurance pooling benefits, tax-related, tax-preferred accounts issues, and both national and global health reform has been recognized throughout the industry. Janet has testified before Congress numerous times, has been published in major news outlets, and has appeared on hundreds of radio and television programs worldwide. Please enjoy.
Well, thank you, Scott, for that introduction. I am looking forward to talking with all of you today. We have a lot to talk about over this period of time, and I want to welcome all of you that have joined in on our call today. Hopefully you'll have some things that will be new to you, that'll be different than what you've been seeing on your normal news updates. So let's go ahead and just jump right in. So we'll just start right off with the obvious, with the presidential election. I know that this has been really controversial this year, but as we look at the election map and the states that have been called, currently we know that Joe Biden has been named the president-elect. He now has 306 electoral votes, and Donald Trump has 232. And just for some of you that have been looking at this, one of the things to remember about this is that we've heard President Trump say that he has contested a number of elections. So now with the count at 306 versus 232, in the states where election protests have been filed, they don't so far amount up to the difference between the two. So all of those election protests would have to be found in favor of President Trump. Now, they could file some additional protests, but it looks pretty solidly like Joe Biden will be the president. So we have to proceed along with that presumption. So some of the material that we'll present to you today is going to be presented to you with that assumption. And I want to talk just a little bit about the Electoral College, because I think that, just quickly, it is very confusing for some of you relative to how that might work. The Electoral College is made up of actually 538 individuals who are appointed, and they cast votes to decide the president and the vice president of the United States. It does take 270 of those to win, and the electoral votes are made up kind of based on population. The idea behind the Electoral College was that that the large states wouldn't just be able to mow down all the small states. And so it's sort of spread out to give the small states a real voice in what happens. And we can see, as we've been a part of the vote counting, that that happens. But what does happen sometimes, it doesn't appear that it's happened this year, is that in future years you might see, and we've seen in the past, where a candidate could actually lose the popular votes or the actual number of votes that are counted versus the Electoral College vote. The two most recent times that this happened were in 2000 when George W. Bush was elected, and in 2016 when Donald Trump was elected. So this is different. When you look at some other democracies around the world, we have what's called an indirect election process, and that's because of our Electoral College. So when you hear that direct versus indirect, that's what that means. It has to do with us having an Electoral College. And that's, to be honest, we are much larger than most democracies around the world. And there's a reason why we have the Electoral College in the United States. And then as we look at the status of the Senate election, we each 6-year period, we have 35 seats that are up for re-election, so about a third of the Senate. This year, 12 of those seats were Democratic, 23 were Republican. And currently, the Senate is controlled by Republicans. So the current count is 48 versus 50. There are 2 seats in Georgia, and you might have heard this on your news reports, that were so close that they're going to be subject to a runoff, which will occur on January 5th. And that Georgia has a special rule about how close that any election can be. And if it becomes too close, then they do call these runoff elections. So if both of those seats went to Democrats, then the number of people of Democrats and Republicans in the Senate would be 50-50, and then there would be a tie vote that would be broken by the vice president, which, if assuming that there's a Biden win, that would be Kamala Harris. So now we don't. It's really probably not even likely that both of those seats go Democrat. So as we look forward and we're making our projections and some of the things that we'll talk to you about today, about things that might happen, we are going under the assumption that Republicans are going to retain control on the Senate side, because that's the most likely thing. It's unlikely that Georgia is going to have both of those seats go Democrat. In fact, probably they'll both go Republican. It's the most likely outcome. So now we're looking at a slide here that talks about the status of the House election. Now, this is very important. I just want to stress we get so much attention on the presidential election, but each of these other chambers is very, very important. The Senate that we just talked about, and also the House, because the president is, the president's not the king. The president is only one branch of government. And so Congress, this House and Senate issue is really, really important. So the House election, currently, Democrats are in control of the House. It was expected that there was going to be what was called a blue wave on the coattails of the Biden successes. But what actually happened is that in spite of these predictions that Democrats would increase their numbers dramatically, they lost quite a few. Every 2 years, all 435 seats are up for re-election in the House, and there are 218 seats needed to control the House. So Democrats did win, but they did so very narrowly, and they currently have 232 to 197. Those are their current numbers. And after the election, 219 to 204. So you can see that was extremely close. But it looks like the Democrats are going to be in control again. And again, as we make these projections about what kinds of things will happen, it's really, really important to know that Democrats will control the House. Republicans are likely to control the Senate. There's likely to be a Democrat in the White House with Joe Biden. So those are things that enable you to say, well, these are the kind of things that people might want to do, but here's what they're actually going to be able to do. So we'll talk about that now. So with a Biden win, with Republicans holding the Senate and Democrats holding the House. And that's the most likely presumption we have at this point. Does that mean that we're going to, because we have divided government, that we'll have bipartisanship? You know, we can look back in history when Joe Biden and Mitch McConnell were colleagues in the Senate. They actually did work together on a number of bipartisan measures. That does not necessarily mean that that will happen this time. There's been a lot of animosity, particularly after Joe Biden served as vice president during the Obama administration. There was a lot of contention between the Obama administration and members of the Republicans in the Senate. So, but on the other hand, let's look at Biden himself. He's a very, very centrist Democrat. And his job is to make sure that he serves everybody, but he does have to serve his own party. And there are many people in his party that are much farther to the left than he is. So to a certain extent, the fact that he has to work with the Republican Senate provides him a little bit of a buffer against the more farther left wing of his party that would say, look, I can only do so much. We're going to try to do what we can, but you know, we have a Republican-controlled Senate, so it's a little bit of a buffer that gives him a reason why he might not be able to do everything that they want him to do. On the other hand, if there's going to be some frustration with that wing of the party. That wing is called progressives. When you hear the word progressives, that is the farther left wing of the Democrat Party. So for those people that see the presidency as a return to things that have been gone the last 4 years, you know, they might express some disappointment. But on the other hand, again, with a Republican-controlled Senate, he doesn't have as many choices in what he does to appease them as he would under a Democrat-controlled Senate. So, in fact, you know, the honest thing is, we can talk about it now about what happens in the Senate. But under a divided government, those really radical ideas, really on either side, become pretty irrelevant in actual policy making. So those things are just unable to get done because they can't get out of the Senate. So why is that? Well, in the Senate, unlike the House, in the Senate, it takes a kind of a supermajority in order to pass most measures. Later on in this presentation, we'll talk about some measures that are able to be passed without having the supermajority, but most of them require 60 votes in order to pass. So when you've got that really narrow majority that I talked about a little while ago, you can see that it's hard to get 60. Now, it might not sound like much, so it might say, well, if it's 50-50 or if it's 50-48, then surely it would be simple to get 10 more votes from the other party. And I would tell you that it is not. It is not simple at all. And most of the time, it's practically impossible. In fact, sometimes Republicans have difficulty holding all 50 of their Republicans together. Same with Democrats. When they held the Senate, it was the same thing. You can't always assume that your whole caucus will vote together. And that's particularly the case in the Senate. So there are other issues that have to do with this divided form of government that I do want to mention, and that has to do with Biden's cabinet. So he will start off making his cabinet appointments, but there are many political appointees under that. So he will he will probably get most of his cabinet confirmed pretty easily. Because he's not going to be able to do things that some people you might have heard about in the news called court packing and filibuster. We'll talk more about those a little bit later, but those are things that he's not going to be able to do. So for the most part, Mitch McConnell is going to allow most of his appointments to go through unless they were really, really far left appointments, and then there might be some pushback. But just to give you an idea, not all presidential appointments are subject to Senate confirmation, but many of them are. And there are 4,000 presidential appointments, and 1,200 of those require Senate confirmation. So you can imagine how important it is that there not be a roadblock on these appointments that are made. The actual presidential appointees are a huge part of making government work. And I think it's the most little known thing that people that everyone doesn't know about is those political appointees that aren't the ones you hear about in the news. They're the others that really keep a lot of these agencies running. And if those don't get through the Senate, nothing gets done, good or bad. So you can't block bad things from happening, and you can't make good things happen either. So those political appointees do a ton of the work. They usually don't last an entire administration, by the way, just for a matter of interest. The average political appointee, not counting cabinet members, but sometimes counting them, the average political appointee lasts about 18 months. And that's largely because they aren't paid very much to do it. And second, because it's just such a grueling job. They work practically around the clock. And most of them, want to get back to their families and the rest of their lives and so forth. So we have a lot of turnover in these appointments. So think of any administration, you've got the appointments happening all the time for people to fill slots where somebody dropped off and you're putting someone else in. So it's a huge thing that we don't hear too much about on the news, but it's very, very important in making government work. So so Joe Biden already has a transition advisory team set up. They will be announcing, nominations during, later this month and into December. So the goal is that they would want to have pretty much everything in place so that everything could get actually confirmed in the Senate as soon as he's sworn into office on January 20th. And this is the way it works in every administration. But they start working as soon as the election is called. They name a transition advisory team, and that is not your transition team. It's the advisory team that sets up a lot of things that occur, and then the transition team, the actual team, comes later. But that advisory team does a lot of work in the meantime, and it's very important. So what are the priorities likely to be? Well, of course, this administration coming in, as well as the current one, has lots of things that they talk about. We're just going to focus today on healthcare priorities. The first thing that we'll probably hear the most about is all about COVID-19. So we'll hear about creating better, infrastructure. There'll be a lot of discussion, as there is now, about vaccine availability, other treatment availability, equipment availability, things that we need to treat it, and so forth. We'll hear a lot more about wearing of masks. We'll hear about contact tracing and all of that stuff. And then we'll see a lot of proposals for money to be poured in for small businesses, for people in general, and so forth. Then the second thing we're likely to hear about is the Affordable Care Act. Joe Biden really looks at the Affordable Care Act, and he considers that kind of something that he and President Obama worked on together, something that he's very proud of. And he's already kind of dubbed some of the changes that he wants to make, which he calls improvements to the ACA, as Biden Care. So what are those things? Well, as people that are directly affected by the ACA may have really different ideas of areas where you think the ACA should be approved. We'll talk about some of those in just a little while. But what are the things that he's talking about when he says, making the ACA better? Well, he talks a lot about increasing the amount of the premium tax credits that people receive. Those are people buying in the individual market, doing some things to make Medicaid expansion work differently. Also, he talks a lot about adding a public option, which in his mind, that is something that's offered in the individual market alongside other things that are available in the individual market. And it would be different than some of the public option proposals that Congress has been proposing, particularly over the last 18 months. And we'll talk about that in just a moment. And his idea of a public option would be an option that's not run by an insurance company, but it would be run by the government, and it would have prices that are set the same way that Medicare and Medicaid prices are set. It would actually not be offered on the same basis as other private plans that compete with it would. So there's a lot of concern about whether it would be disruptive and cause some damage to the individual market because of creating an unlevel playing field. So there would be a lot of discussion about creation of such a public option and how it would look. And by the way, I will mention that would be very, very difficult to get past a Republican-controlled Senate. He's also talked about changing the Medicare eligibility age to age 60. This is different than some of the proposals that Congress has put forth, which would actually create buy-ins from age 55 to 64. This literally changes the Medicare eligibility age to age 60. It would be a very expensive proposal, probably very difficult to get past a Republican Senate, if only because of the price tag. And then there's a lot of discussion about undoing Trump regulatory efforts. I'm going to talk about that in a minute, but that one of the things that people worry about is whether or not any new president that comes in is just going to wipe the slate clean on any executive orders that a prior administration has done. So it's not as easy to do that, but he will be able to undo some of those, and he probably will. So some will be easier than others. But think of things like that these Democrats in general didn't like. So things like association health plans. There were some changes to the way temporary health insurance works that they didn't like, and a few other things like that they believe are not adequate coverage for people. That's kind of the general theme. Anything they thought that was inadequate coverage is likely to be attempted to be undone. And then there will be some emphasis on improving health disparities. And what that means is just making sure that there's adequate medical care available to all populations, regardless of who they are, where they live, that they can access health care in their own communities, that they can access nutritious food in their own communities, and so forth. And then there will be also a new look at maternal mortality, which is definitely unevenly spread across our country, but it's really too high for a developed nation like ours. And then some of you may be happy to know that there would be some additional focusing on drug pricing reforms. I know that prescription drugs are a huge part of almost every health plan's expenses. So there are some of the things that the Biden administration has that a Biden administration would focus on would be limiting launch prices, which they may be able to do some of that through the regulatory process. And remember, because of kind of the breaks that come on in the Senate, a lot of the things that a Biden administration will try to do will be through the regulatory process, because they won't be able to get anything that's controversial through the Senate. Also, by regulation, they could allow, they could expand the amount of prescription drug importing that we are able to do now. There could be some penalties imposed on prescription drug price increases that are greater than the general inflation rate. Establishing independent review boards to look at biotech drugs, which ones are kind of what we call Me Too's and which ones actually create a new disease-fighting opportunities, and a number of other things kind of in those categories. And then he's also talked about delivery system reforms, but it's kind of a little bit of some of the same focuses, such as on transparency and making sure people can see across the board exactly how much things cost, but also more on value-based purchasing to make sure that providers are really engaging in preventive activities and taking care of chronic disease on a proactive basis. That's sort of some of the things that they've talked about focusing on. We can expect additional focus on mental health and substance abuse issues, which in general is good, but from the employer perspective, that could mean kind of a hyper focus in on network adequacy, which I know is really difficult sometimes to get the number of mental health providers in your network that you want to be in your network. So those are, and some of the subspecialties. So those are things that could be focused in on. We'll have to see if that really occurs. Increased investments in community health centers. That's part of this improving health disparities, to make sure that there is adequate access to health care in all communities. elimination of surprise billing. And those are, some of you have probably already dealt with this, where people go, your employees go to a network location only to find out that one of the providers that treated them during the course of their visit was out of network, and they receive a huge out of network bill as a result of that. So there's a lot of discussion about surprise billing. And then one of the things that we can also expect to occur is making COVID-19 changes permanent as they relate to telemedicine. So this expansion that we've seen in telemedicine is probably here to stay, including the expansion into specialty care, which is not always possible, but some of it can be done on a kind of a virtual basis. I wanted to talk a little bit more about the public option, only to show you that Congress has been quite active on this already. And the point I want to make by showing you this slide is only to show you that during the last Congress, these are all the pieces of legislation that had to do with either a Medicare buy-in or a public option. So when I mentioned that what Joe Biden wants to do with his public option is in the individual market, what I want to let you know is that that's not everyone's opinion of how it should function. There are a number of members of Congress that think that a public option should be offered much more broadly than that. And for example, this Medicare X buy-in offers it in the individual and the small employer market, and additionally says that if a provider does not want to participate in this Medicare X buy-in, and why would they not? Because they're being paid lower rates than they would be under a private plan, then they would not be able to take Medicare patients either. So kind of a, you better participate or else kind of thing. And then this Medicare E buy-in is a particularly onerous version, and Medicare E is offered in the individual market, the small employer market, and the large employer market. And it also has a provision that would change the pricing in the large employer market to modified community rating, which would be really devastating for the large group market. So these are things that would have trouble getting through the Senate. But again, they are things that you have to be really mindful and watch for, because there are other provisions and ways that things can get through and get around this supermajority requirement. And what it really is avoiding a filibuster. And then I want to talk a little bit about surprise billing. It's possible that we will still see some work on this for the rest of the year. That we've had so much activity in Congress on this issue of surprise billing and what to do with when consumers or employers or both get stuck with these large bills. There are two different ideas about how you might fix this. So the options are a benchmarking, which is really to set up a rate that's kind of based on sort of a combination of an average of in-network rates. And then that's what an out-of-network provider that's practicing at an in-network facility would be reimbursed on. So it's based on kind of market levels. And the thing about this is it's predictable. So your pricing can only be a certain amount. So there's at least some predictability to it. It doesn't force the providers to go in-network. It just says, look, if you're going to practice at an in-network facility, this is how much you're going to have to accept as your payment. And then the other version is arbitration. And that is really done through a third-party arbiter. It's much more expensive to do it this way. I will say that. And it's also much more expensive, particularly for self-funded plans. It's a lot more expensive way. So what are they going to come up with? If I had to predict this, I would say they're going to come up with a combination of these two things. Perhaps where there's a benchmarked rate that allows up to a bill at a certain level, and then if a bill is over a certain amount beyond that, that it would be arbitrated. We'll have to see, but it's possible this could even pass before the end of this year. If not, you can expect it to be pretty high on the priority list in the next Congress. And then the thing that I want to point out here, we do not currently have any legislation that would try to take away the employer tax exclusion. But I mentioned this to you because when we start talking about things that improve the ACA, like increasing the amount of the tax credit, or really any sort of benefit that we want to spend more money on, they have to figure out how they're going to pay for that. And so it's pretty common for both Republicans and Democrats to look at the employer tax exclusion as a potential pot of money that they might want to consider and to take away all or part of the tax exclusion. So the tax exclusion is the amount that employers pay for their employees' health insurance. It's not an employer's tax deduction. It's the fact that the amount that they pay is excluded from an employee's income. So why does that matter to an employer? Well, if you take away that tax preference, the entire employer system could unravel. Because what would happen is the people who are your healthiest employees, the ones that really stabilize everything for your overall pool of risk in your particular employer situation, would be the first ones that would drop out of your plan. And the ones that would remain in are your older and your sicker workers, which is death knell for an employer plan. You want the young and healthy ones in too. So this is something that we've really opposed a lot, but we see it very frequently looked at as a potential pot of money that to go after, to take away this exclusion, to create a new taxable income for the federal government. And to give you an idea of why it's such an interesting thing that people look at, members of Congress, when they want it as a potential funding source for their pet project, is that it's worth hundreds of billions of dollars every year in lost tax revenue. But it does support a very expansive system across our country. And then some of you might be interested to know that we have legislation pending in this current Congress on employer reporting, and that's likely to be introduced in the next Congress as well. So it would create a voluntary reporting system so that you could keep using the reporting system that you currently do now if you wanted to. But if you don't like the current system, you could use this voluntary system where you report in advance, here's what we're offering, here's the people we're offering it to. It's much, much simpler than the system that is currently in place. So this has bipartisan support. All of these do. Now, all of these pieces of legislation that I'm showing you will have to be reintroduced in the next Congress, which will start over in January. And then the lame duck session. So the lame duck is after elections when members of Congress come back. That's called the lame duck session. And there are certain things that have to be addressed during this upcoming lame duck session, not the least of which is that funding for keeping the federal government open, which must be decided by December 11th. And that's when the existing funds go away. But things can be attached on to measures like this, other things. So this is where we're thinking that possibly some of this legislation regarding surprise billing could be added on. It's also, there will be a lot of discussion about a new coronavirus aid bill, but it is extremely controversial. So Democrats are proposing about $1 trillion, and some are proposing a $2 trillion legislation to fund all of the things that they want to fund. There are Senate Republicans again, think of them as the brakes on most things. They're looking at $500 billion. They both want aid. The big discussion is on how much aid that should be. And then some of the other things that are very, very likely to occur in the lame duck session, during the course of his presidency, President Trump has been one of the most active with court appointments. So just literally many of, not just Supreme Court that we've heard so much about lately, but also these other court appointments. So we have one left. We have one appellate court vacancy and 56 district court vacancies. There are many, many nominees that still need to be confirmed, and we're likely to see kind of a really rapid fashion lame duck session, particularly if it looks as if those two seats in Georgia would go Democrat instead of Republican. So probably they're likely to push these through just in case, because remember that they only hold office in the House and Senate under the current elected official program until the end of the year, and then the newly elected officials will come on in January. So if they have any question at all about whether or not Republicans would maintain control in the Senate, they'll push through all of these nominations that they already have so that they have more control of the judicial branch of the government, or they feel they have more control. I will say you cannot always predict what a judge is going to do. Very important to remember that judges they don't just follow a party line or anything. And any of these bills that have currently already been introduced, if they don't pass during this lame duck session, by the end of this year, they're considered dead. They don't carry over, but again, those that don't pass will be reintroduced. Many of them will be. I know you've heard a lot about, will the filibuster go away? Well, obviously, Republicans in the Senate aren't going to take away the filibuster, but I want to really point out that the filibuster has been used by both parties many times when they're in the minority. And they use it to keep legislation from going through that they don't like. Sometimes they use it just to be ornery. And both Republicans and Democrats do this. It's been used both times. So a lot of people have said, well, if Democrats take over the Senate, the first thing they'll do is get rid of the filibuster. That's kind of short-sighted on their part, even though there are many times when we get very frustrated about the filibuster itself. But I will say that there are also times when we're glad that it's there to keep bad things from just rushing through and to at least allow for more discussion on particular issues. But it's unlikely that the filibuster is going to go away because no party can assume that they'll always be in the majority. And if they're not in the majority, the filibuster works for either party, no matter who it is. So there are certain measures, just for your information, that are not subject to court appointments for the filibuster. One is the court appointments. So that's how we got through our recent Supreme Court justice that I'll talk about in a moment, and some other court appointments. Those are not subject to being filibustered. They just need a simple majority to pass. And then the other one is reconciliation bills, which are budget bills. And I'll talk about that in a moment. Very important about reconciliation bills, which is my next item. So reconciliation, or a budget bill, it's a two-step process. It allows Democrats or Republicans in a different, if the situation's reversed, it allows them to enact legislation that's kind of far-reaching. So think tax, spending, healthcare, climate change. These are things that can all be done in the reconciliation process. So why is that? If it's a budget bill, well, they're not subject to being filibustered in the Senate, but it's only things that affect directly government spending. So climate change can be directly related to government spending if you're authorizing dollars to be spent for it. The same way on healthcare, if it's strictly related to the dollars being spent to authorize certain things, spending bills, tax bills. So things that are like, should the District of Columbia be a state? Or should we have gun control? Or should we allow the Supreme Court to be added to? None of those can work via reconciliation because they don't have to do with spending. Just to give you two really recent examples, in 2010, Democrats used reconciliation to pass the Affordable Care Act because there were so many spending measures included in that. And in 2017, Republicans enacted major tax reforms in a reconciliation bill. And if you're curious, when we took away the tax penalty for the individual mandate on the Affordable Care Act, that was also done via the reconciliation bill. So they take this budget bill that they're already working on and they just tag these other things along to it. Sometimes the things tagged onto it are bigger than what they were working on to start with. So this is used every year, and sometimes we are able to use it to our advantage to get things done that we want to get done, or to keep things from happening that we don't want to happen. But it all has to be tax related, and if you can't make that connection, then it can't be tagged on a reconciliation bill. And then the Congressional Review Act, I think, is really important for us to talk about. The Congressional Review Act allows Congress to overturn certain executive department's agent regulations. Most important is that it has to do with executive orders. So when a new administration comes in, this question that we mentioned earlier, which things can they get rid of? Well, the fact is that it really only, there's a lot of details on how this works. But for the most part, the only things that they can just instantly wipe the slate clean on are things that happen in the last 6 months of the administration. So think of things from about June 1st, 2020. So any executive orders or guidance or regulations that came through after that time could be overturned by a Biden administration. Anything that was before that, it's possible to overturn it, but the process to do it is very difficult and involves Congress. So it's much harder. But there are a number of things that have occurred, but some of the things that there are the biggest grievances about that occurred during the Trump administration, that grievances among Democrats is what I'm talking about, is those are the things that might be more difficult for them to do without congressional action. And again, can they get it through the House? Yes. Can they get it through the Senate? Unlikely. So we might have a lot of the same. Now, can a Biden administration issue all kinds of new regulations and executive orders on its own? Of course. So you're going to see a Biden administration operating a lot in that regulatory zone. And then I want to talk lastly about the Supreme Court. We heard oral arguments last week on November 10th that had to do with California v. Texas, which is the question about the constitutionality of the Affordable Care Act. The oral arguments were very interesting. They focused on, does anyone actually have standing? In other words, has anyone actually been harmed by the fact that there was an individual mandate? With the penalty for the individual mandate, should the mandate itself go, or should other parts of the law go with it? If the entire ACA is determined invalid, then what would the Supreme Court do? Would they consider that it's unenforceable nationwide, or is it unenforceable only to the extent that there are provisions that injure people? And then if we want to say, well, what are they going to do? We don't know for sure when we'll have a ruling from the Supreme Court. It could come as late as May or June. I think probably somewhere about February or March is a lot more likely. But you can kind of interpret a little bit if you listened to the oral arguments about how they might act during something like that. So during the 2-hour-long oral argument session, there were at least 2 members of the court that are considered conservatives that seem to have some reservations about completely undercutting the ACA. So, for example, Justice Kavanaugh said that it seems like that it's pretty straightforward. What we should do with this is that we would just get rid of the mandate language itself and leave everything else in place. And I heard a number of people say that of justices say that, or something to that effect, during the time that the court was convening. And then we have Chief Justice John Roberts. And remember, he's the one who's had 2 previous opinions relative to aspects of the ACA. He said it's pretty clear what Congress intended here, that Congress didn't seem to intend for the whole law to go away. It seemed clear to him that Congress left the law intact when it lowered the penalties for the individual mandate down to 0. In other words, when it took away only the tax penalty for the individual mandate. And so that seems pretty compelling evidence. So if I were going to predict, I would say that the court's just likely to rule that since the conservative justices outweigh the more liberal justices, I think it's likely that that's probably what might happen, that they would just take away the mandate language and leave the rest in place, which would effectively be a very little change in terms of any practical application, because we're already sort of operating in that realm, which is why they had said that they thought they should deal that way. And finally, I will go to questions now. We've been answering some of your questions during the course of this, but one of the ones that I really want to just make clear is that it is possible for the average person, whether you're an employer or someone else out there to make a difference by getting involved yourself with your own member of Congress. So I would encourage you to try to do that and make a difference. And believe me, every single vote and every single call to Congress and every single letter, even if it's a form letter, does make a difference. So I encourage you to, see that as part of your responsibility as being a citizen. And we have answered a number of your questions, but I would like to invite you that if you have questions that we didn't get to during the course of this session, to please let us know what your questions are, and we'll get back to you as soon as we can. Thank you very much for your time today.